Hi everyone, welcome to my channel and a very happy new year and I hope everyone is doing well in 2024. And coming back to today's video topic, I'll be discussing on group health insurance policy, specifically corporate insurance policies. One of my subscriber has asked previously to discuss on health insurance policy on TCS, but I will compare TCS with some other organization as well. But before that, let me quickly tell some of the facts that is some of the information that I recently received. So there are layoffs happening here and there, mostly in product-based companies, but service-based companies and Big Four are still stable. So there is no such news. And also, like IT sector is stagnant. So if you are looking out for a job change, it is may not be the good time. You need to wait for maybe 2 3 months more. Maybe on April we can possibly, in April we can possibly understand that if the market is opening. But as of now, Cognizant is hiring, Big Four is also hiring, here and there. TCS is not that hiring. They lost 12,000 employees in past quarter, but their hiring rate is very less. Infosys is kind of a stagnant. They are also not hiring. So only few companies, including Accenture, Cognizant, US MNCs, they are hiring in a low rate, and the hike that they are giving is approximate 30 40%. So it not might not be a good idea to switch in this current moment. What I feel now, coming to the today's topic is interesting because this is the only perks that employee receives in which is really a good part, I believe, in corporate. Now every companies have their own insurance policy. So if you talk about corporate insurance, is broadly classified to two. One is the life insurance, which will be approximately 10 lakhs to all the way to 1 crore, sometimes slightly higher based on the designation experience. And one part is the health insurance policy, or HIS. So I'll talk about the HIS only. So usually in US companies, they don't deduct this premium. They pay on top of the CTC, and in some companies they also deduct the uh, certain amount from the CTC for this group insurance, for this insurance policy basically. Now it could be 10,000, it could be 20,000, it could be 500 per month, so based on the company. Now I'll start from beginning. So let us talk about Accenture. What an Accenture employee get benefit. So in Accenture, the benefit of health insurance scheme is approximately 3 lakh rupees. Sometimes it's 5 lakhs. So it is between 3 to 5 lakhs in usual case, and it covers only the employee and the dependents. Dependents, as in it doesn't cover the parents. So only if he is married, they are married, possibly spouse and kids are covered in the this floating insurance provide insurance coverage, and it is cover only IPD. So if IPD means, if the person is get admitted to a hospital, then the bill will be covered and it has a co-payment. So the entire bill will not be paid. So for employee it is 90% paid by the insurer, and 10% will be the employee has to pay. And for other dependent it is 80 20, so 20% will be paid by the employee's pocket. Now if we need to include our parents, so possibly we need to give some additional premium. And on top of it, if you wish to increase your premium, like which is maybe 3 lakhs, you want to make it 10 lakhs, so you need to pay additional amount, and that will be deducted from the three installment from your salary. So that is about Accenture insurance. Not so good, I believe. Just has a OPD coverage. Nothing great in terms of insurance, like health insurance. Now coming to Cognizant, which is slightly better. Then I actually made it the second list. So in Cognizant, what we'll receive is IPD coverage as well as a free health checkup usually. So in IPD coverage, the good point is you can, along with you can also add other member from your family. So it might be your spouse if you are married, and it might be your parents. So the good point is, suppose you are married and you have a kid and you have also parents, so four person you cannot be included, right? So there is a three. So you should add first your parents and your spouse. Your child or your kid can be then added at an extra premium, because what will happen if you add your spouse and kid, and if you add your father, for your mother or your father, whatever, their age is pretty high, and for that you need to pay some hefty amount of money as an installment, as an like premium. So do not do that mistake. Add the highest, like the people who has attended the highest age and the lowest percentage, you can add it as additional member, you can pay additional amount which will be less. So that is one trick that people should follow in Cognizant. And for the free health checkup, they usually have a tie-up with multiple hospital. You can get it as a free. You need not to pay anything. So once in a year, you can get your health checkup done. And for all these company, basically, they usually tied up with either National Health Insurance Company or United Insurance Company. Both are government companies. And on top of it, they either have a Vidal or a MediAssist, TPA. So you need not to talk with the insurance provider. You just need to call your respective TPA, which is MediAssist or maybe a Vidal, and they will arrange everything for cashless facility or for health checkup, or your queries can be asked. They have a dedicated phone number for company specific, so there is less wait time basically. Now coming back to the third company that I have placed, so which is slightly better than even Accenture and Cognizant, that is Wipro. Now Wipro has the problem because Wipro only covers the employees; they don't cover anyone. So if you need to add all your dependents, you need to pay additional premium for that. So that is one negative point. And Wipro has a very minimal insurance coverage, so it's about 2 to 3 lakhs based on the employees seniority. Now the good part of Wipro, however, is if you pay some additional amount, you can access basically OPD coverage, so that is called domiciliary. So in domiciliary coverage, what will happen, Wipro has a facility that you can ask for 10,000, also 20,000. So suppose you have taken 20,000 rupees as a OPD coverage, then whatever medicines or whatever doctor you are visiting in a 1 year, you can claim them basically up to like certain limit, that is 20,000. So that, and that could be applicable for all of the family member that you have taken during the that you have declared during the initial time. So that is one of the good thing I believe domiciliary, that is present. And one point is from Wipro, uh, from manager and above basically, they have free health checkup. So but it is from M level onwards, once in a month, and age should be at least 35. So there is two criteria. Now coming to the other one is ENY, basically a big four company, where you will get IPT coverage, modular benefit, as well as domiciliary benefit you can get through the additional monies, like additional premium. So in IPD they will default, you will get, and in IPD you can add your spouse, in-laws, as well as your parents also. So lot of benefit is there, but some additional benefit, additional money. And the base coverage is approximately 5 lakhs. It depends on the position. Definitely average you can ask, you can consider 5 lakhs, and on top of it you can increase to 25 lakh as well by paying extra premium. You can also offer the OPD benefit up to 20,000 rupees by pay some additional amount of 3 4,000 rupees, which is definitely a good, because your medicine, your entire family's medicine and doctor fees can be reimbursed easily. And there is a co-payment as well, it's 80/20, or for the dependents, and for you it's 90/10. So that I discussed in Accenture, so they have a co-payment, and for Cognizant also they have a co-payment. Now coming to modular benefit, now UNY has they also offer some modular benefit, if you if your dependents, or if yourself required some physiotherapy or some other stuff which is slightly outside of the medical stuff, then you can also opt the medical modular benefit with paying some additional ins- coverage, and you'll get this additional benefit. So this is all about UNY. Now the best insurance coverage provider, definitely one and only TCS. There is undoubtedly, there is no doubt in service based industry. Now coming to TCS, I'll show the TCS insurance. So the basic coverage you can see is 2 lakh rupees for the insurance person, and on top of it, if it is a higher hospitalization, they will pay approximate 12 lakhs, and these 2 plus 12 14 lakhs is floater, so it will be all together for the entire family. They need not to pay anything, and there is no co-payment. So that I told right here, there is no co-payment, so entire hospital bill will be reimbursed through their insurance provider. There would not be, employees need not to be pay anything. Now on top of it, 6,000 rupees domiciliary or OPD benefit will get for each person of the family. So if there is 5 family member attached to that insurance, so they will be eligible to get 30,000 rupees. So that is the best insurance I feel. uh, for TCS, there is no co-payment, there is IPD, there is OPD as well. So this is all about the insurance, stuff that is for these 5 companies. Let me know in the comment below what your companies is offering currently. Thank you.